You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, you could get a fixed set of teeth in just a few appointments. With us, we have Dr. Tony Feck. Dr. Feck, welcome to the program.
Thank you for having me.
Now, for people that don't know you, tell us a little bit about your practice, who's your typical patient, and what are the different procedures you offer?
Okay. Well, I have a general dental practice in Lexington, Kentucky. Been there for over 30 years now. And my typical patient is every patient. We see people from the very young to the very old and everyone in between.
Okay.
They come here for different procedures. It could be fillings, it could be extractions, it could be dentures, and many times it's implants.
Okay, good. Now you also, I guess you lecture to other dentists across the country. Tell me a little bit about that.
Well, after I graduated from dental school, I was invited to be on the faculty of the University of Kentucky College of Dentistry, and I found that I really enjoyed education. So in addition to my private practice treating patients, I get the opportunity to travel all over North America and occasionally internationally to teach other dentists techniques that I've been fortunate enough to learn.
How long have you been doing dental implants?
Almost 20 years
20
at this
years.
point. Yeah, we were one of the very first practices to actually use implantology to help our patients.
Okay, now we said at the top of the show, and we'll jump right into dental implants, no more dentures. Elaborate on that.
Well, most people who wear dentures would rather not wear dentures. So it's great to give people the option of dentures that aren't traditional, dentures that allow them to comfortably chew and feel like they have their own teeth again.
You are in Fayette County.
Right.
Are there a lot of denture wearers there? Like an upper or lower denture? What's your estimate?
There's a lot of patients who have dentures in this area.
Like how much?
I would say probably upwards of 30, 40,000 patients in this area alone. It's not a very populated area, but there are a lot of denture wearers and a lot of them just don't know the options that they have.
Okay, now you say that with just 2 implants, they could get a full arch of teeth that snap in, snap out, no adhesive.
No adhesive.
Okay.
No more movement.
If it's so good, why, and you're saying like 30,000 people, why aren't they all doing it? What's your take?
I don't think they know their options. You know, people with dentures don't visit the dentist very often, and they aren't aware of new advances that allow them to have comfortable teeth, allow them to have the confidence of having, they're almost like having their real teeth again, being able to chew whatever they want to chew, being able to smile confidently, being able to, have their own teeth again, or at least the closest thing to that.
You say you're changing people's lives.
Yeah.
Really?
Yeah.
With just teeth?
Well, that's what I hear. I know it's hard to believe that new teeth can have that big of an impact on your life, but I have patients tell me on a regular basis, first of all, they wish they'd done this sooner.
Okay.
But then after they come back, they say, you know what, I never realized how much I missed having my real teeth. And they talk about feeling younger. They talk about being able to smile confidently. And they talk about being able to be more active in their life. And that is life-changing.
Now, why is it what used to take, let's say, 9 months for dental implants now can happen in a visit or 2? Why is it so fast now?
Well, there have been new advances in technology, new advances in diagnostic equipment, new advances in the actual implant product itself. And now what used to take months, even years, and multiple procedures can now often be completed in as little as 1 procedure, many times 2 or 3 procedures in a shorter period of time.
Okay, now, the way it's normally done, and correct me if I'm wrong, the way it's normally done is you go to one doctor that does the surgery.
Right.
Then you go somewhere else, and the other doctor that puts the crown on top, and maybe somewhere else for the imaging. You do it all right there.
Right.
Aside from convenience, or is that maybe that's the biggest, what's the advantage with the,
Well,
the fact that you do all of that?
the advantage is obvious to the patient. The patient doesn't have to go multiple places. The patient doesn't have to develop multiple relationships. They've got one provider that they're comfortable with, and they can get all of these services provided at the same place.
Now, people don't like going to the dentist, right?
They
You
hate
hear
going
that?
to- I hear it all the time.
Like, what do they say?
They say, I hate going to the dentist. I'd rather do anything than go visit a dentist.
Do you have a line for that? What do you say when they say that?
Well, I just kind of chuckle because I hear it so often. I mean, I'm not going to convince them that they're not correct. I would probably feel the same way if I were in their place.
But I talked to your office, and I'm paraphrasing slightly. They say, but they like coming here.
Yeah.
Really?
Yeah, I think because we appreciate how they feel. Okay, we understand that that's not their favorite place to be. It's a source of anxiety. They've had bad experiences in the past. So, why not feel they're going to continue to have bad experiences?
Okay. Now, pain.
Yeah.
You say it's not painful. But pain, it seems painful.
Yeah. Well, they've had bad experiences in the past. They've had painful experiences in the past. But there are new ways to make people more comfortable. You don't have to go to your dentist that you grew up with anymore. Now you can come, you can go to the dentist, and we have relaxing treatment. We have ways that we can make people feel less afraid about what they are about to experience.
Okay. IV sedation. I guess you're one of the few general dentists, I guess, in the country that does IV sedation. What percentage of patients that do this get that sedation?
In my practice, because they've heard that we provide these services, probably more than half of our patient population gets sedated, and we use an IV, and before we put the IV in, we actually give them some oral sedation so that the IV is more comfortable. But with an IV, we can control both the depth of sedation as well as the length of sedation.
Okay. I think you told me that on the telephone that some people, when it's all done, they go, that's it?
Yeah.
They don't remember it?
No, they don't. They have very little memory of the experience. I've even had, and again, this is unusual, but I've been doing this for so long, I've had the experience where a patient would actually call later in the afternoon and apologize for missing the appointment.
Really? You have to tell them, hey, by the way, you already had them done.
Yes, you just don't remember it. Just go to a mirror and look in your mouth, and you can see that you were at the dentist.
So what are the categories of dental implant patients that you see?
Well, lots of different categories. One category is the person who's missing just one single tooth.
Okay.
And they may have been missing this one tooth for several years, and they come to me and they ask, what are my options? And we talk about bridge work, which is where you prepare the teeth on either side of the missing tooth.
Prepare being what? That kind of carve them down?
Yeah, you trim the teeth down on either side. You make them smaller so that we can place crowns over top of those smaller teeth now, and then a false tooth in the middle. That's called a dental bridge.
Okay. And that works?
Yeah, it works. And there are times where that's actually a good treatment, but it still has to involve treating, many times, healthy teeth.
Okay.
So another option, besides a bridge, is to use an implant. And an implant is just an artificial root made out of a biocompatible material, and it's very comfortable. It's like having your real tooth back again. So now, instead of having 3 teeth connected together by a bridge,
well, how long can a bridge last?
On average, 10 to 15 years.
Okay.
But a dental implant has the potential to be a lifetime option.
So it's like getting your tooth back?
It's the closest thing to having your tooth back that we have.
So it could be cheaper in the long run then?
Absolutely.
The bridges only last?
Absolutely. If you do a bridge, if you're a young person, you do a bridge and it lasts you 10 to 15 years, you might do that bridge 2, maybe 3 times in a lifetime.
Okay. Do you think the future of dentistry, I'm skipping over to the denture wears, but do you think the future of dentures will always be attached to dental implants? What are your thoughts on that?
I think we are getting there. More and more people are realizing that traditional dentures that rely on suction, where this denture just rests on the gum tissue, is not the best option. Many people can manage with it, but it is a compromise to the quality of their life.
You say they're not really chewing, denture wears.
No, they're not chewing.
Elaborate on that.
When we have real teeth, we chew in a pattern. Okay, but when we have dentures, in order to keep the denture stable, we have to chew up and down. And this is it's a compromise to function. It's an inability to use your teeth the way you had used your teeth when you had teeth.
Now, I know a few denture wears.
Yeah.
I think 2 that I know of. And they've never complained about their denture.
Right.
Do you think there's some people that are happy with their denture?
Well, it's relative. In other words, they're happy because that's all they have. But many times, if they had the option to have dentures that were connected to the jawbone, like teeth, like real teeth, then it would be so much better, so much easier to chew, so much easier to smile, and to have an active, healthy lifestyle.
If there was like a free trial on a weekend, I know it's not possible, right?
Right.
Come and get your denture secured by dental implants. Do you think unanimously everybody would say, I can't go back to my...
I can't imagine anyone wanting to have a traditional denture if they had just 5 seconds with an implant-connected denture.
What do patients say when it's all done? I mean, do they get angry that I should have done this years ago?
I hear that all the time. Patients will say, I don't know why I waited. I thought implants were uncomfortable. I thought that they were incredibly expensive. I heard that they didn't work. And these are all common misconceptions that people have about implants. I just had this recent patient. Her name was Lynn. And Lynn came to see me, and she had a couple of missing teeth, and we talked about her options, and she chose the implant option.
Okay.
And the case went beautifully, and then when I saw her on follow-up, she said to me, she goes, I never realized how much I missed those 2 teeth. And I was really anxious about the process. And personally, I didn't realize that she was anxious about it, but she said, you all explained it so thoroughly that I just felt confident. I just felt like I was in the right place. And now that it's all over with, I could kick myself because I should have had this done earlier.
Now, you've been doing this for 20 years, right? You take a lot of courses. You you lecture to other dentists. Is that right? From all over the country?
Correct.
About dental implants. Does it cost more to go to a guy like you?
No. Why should I charge somebody more just because, I've had this background? What I enjoy is seeing people's life get better as a result of something I've done for them. So I'm perfectly compensated. I don't worry about that. The most important thing is taking care of people.
In all areas of dentistry, I guess there's cosmetic, there's this. Are the denture wearers that you give them their teeth back, is that the happiest group? Do you find, or tell me?
Yeah, a denture wear especially, because dentures are such a compromise to normal function. When I do a procedure on a person who has their natural teeth, they're happy about the results. But when you help someone who has artificial teeth that is moving around in there, that gets food underneath it, that they get sore spots, that they actually change the way they talk, they change the way they eat, they change the way they smile, and then you can give them that back again, I think it's easy to see why those are the happiest patients.
Is that your challenge, by the way, getting the word out? Because denture wearers don't, like you said earlier, they don't go to the dentist. And people need to know that this is a real interview. I'm not siding with you, I'm just asking you the question. But I am asking, is that a challenge for you? Because the denture wearers don't go anymore to the dentist, for the most part.
Yeah, it's not only a challenge, it's really frustrating because I know what I can do for them and they don't know that I can do it. So getting the word out is crucial so that people can appreciate that the rest of their life can be better, that they can have what they've lost, they can have it back again.
So what are the age ranges? I mean, as far as who is a candidate for dental implants? How old can you be?
There is no age range. In other words, it doesn't matter how old you are. If you want a better quality of life, then we can treat the 70-year-old, the 80-year-old, or the 90-year-old.
What's the oldest patient you've heard that goes in for dental implants?
I've treated a 92-year-old patient, and she was just a delight to work with.
Why would a 92-year-old want to do it? And why would you want to put them through
I'm
that?
reminded of the lyrics to a country western song, and they say this,
Okay.
I want to live until I die. And how old are you that you no longer want to have a good quality of life?
Interesting.
Yeah.
So is there a tipping point, like where denture wearers have had enough with their denture and then they end up telling you this is what happened?
Yeah, there's usually a point where a person who's wearing dentures will say, you know what, I've endured this long enough. Many of the people that I see in central Kentucky have been wearing dentures since they were in their 30s, believe it or not. And now they've had dentures for 30, 40 years. And by that time, the supporting bone underneath those dentures has shrunk to the point that there's really nothing to hold those dentures in place anymore. So now they rely on adhesive, and that's messy and uncomfortable. And I get to a point where they said, you know what, I'm done with this. I'm done with the compromise that are conventional dentures.
Isn't it true that if you've been wearing dentures for 30 plus years, you don't have enough bone to do the procedure?
There's never a point that we cannot help you with implants. So it doesn't matter how long you've been without teeth. It doesn't matter how much bone you've lost over time. There's a way that we can help you with implantology.
Have you ever had to turn anybody away because they didn't have enough bone?
Never.
Interesting. Have you ever, I think you told me this on the phone, that you've had patients that come in that were turned down at other dentists saying you don't have enough bone. That's why I asked you about this bone.
Yeah.
and that you're able to do it. So what is it that you're doing that's different than?
Well, it's a common misconception that is perpetuated sometimes by the dental profession.
But has that happened where your
Yes,
patients have been told they didn't have enough bone somewhere else?
They've come to me and they've said, I've been told that I cannot have implants. I don't have enough bone. I thought I would try you to see if you had any solutions to this. And we do have solutions.
Then what are you doing that's different? That's the part I'm not catching. I mean, is it they don't know? They don't have the technology?
Well, what we're doing
I know you want to be positive here about other doctors.
I know. And what we're doing that a lot of other dentists have not done or are not doing yet is that we're using imaging that allow us to place the implant in the places that take best advantage of the bone they have, number one. Number two, we're using new implants. You know, what keeps an implant in the bone is the amount of surface area. So we've got new implants that allow us to take advantage of that, so we can place even shorter implants that are wider and give us the option of people who have less bone to still have implants. I have this one patient, and she'd been to another dentist, and she'd been told that she didn't have enough bone to support dentures. And so we look at her, and she did have less bone than a lot of patients have, but there was enough there for us to work with. Using imaging, using new technologies, we were able to place enough implants so that she could have an implant-supported denture. And she's doing great, and we were able to help her when other people said, no, sorry,
okay,
can't help
good.
you.
Now, these are, well, give me the options. Okay, so a denture wearer goes in.
Okay.
Take me through that process. You know, what do they want to know? What do they ask?
Okay.
How do you present the options?
All right. Well, most patients, when they come to see me, they say, first of all, you know, am I a candidate for dental implants? And the overwhelming majority of people are great candidates for dental implants. So we do a complete exam, including radiographs, x-rays, and we do a visual exam, and then we talk to the patient about their options. And one option is the patient could have 2 implants placed, and they could have a snap-on denture.
Okay, so they get a full arch of teeth.
Yes, they get a full arch of teeth, but the advantage to that over conventional dentures is that the roof of the mouth is now uncovered. So the patient can feel the temperature of food. They can taste their food better. They feel like they've got less plastic in their mouth. So that's one option. 2 implants to support a snap-on denture. Then we can have 4 implants to support a removable denture, and we've even got more support.
What can you chew with these implants?
Whatever you want.
Like 4 implants? Really?
Whatever you want. So if it's corn on the cob, if it's biting into an apple, you can chew whatever you would chew with natural teeth.
How soon can you eat? If everything goes right, how soon can you eat?
You can eat right away. We will tell our patients to eat soft foods for a few days, but after a few days, then they can gradually build up to whatever they want to chew.
Do people ever give you eating stories? You know, they come in, doctor, I just had this, I had...
Yeah, they talk about, you know, I had just given up biting off celery, for instance, with my front teeth, or biting off a piece of pizza with my front teeth. I would cut it up with a knife and a fork and put it on my back teeth. So they talk about, you know, things you and I, we take it for granted, but to a denture wearer who has to alter the way they live, you know, this is something that's extremely valuable.
So Lexington, Kentucky, you'd like to wipe out dentures?
I'd love,
at least the way we know them now?
I'd like to change the way people think about dentures. No longer is this just a piece of plastic that they put in a cup and bedside at night, but now they've got something that gives them their teeth back, their way of life back.
Now, you know, when 50, 60, 70 is very young today. People are dating 70s. Do you notice when you do the procedure that now maybe they're going on job interviews or they're dating again?
Yeah, see, I've got
do you hear these kind of stories?
Actually, a patient comes to mind that he was actually a widower, and you know, he got to a point in his life where he says, you know what, I'm ready to get my life back. And he came in and he was doing all kinds of things in order to gain control of the confidence that he used to have. And one of those things was that he was going to get rid of his dentures. He wanted the dentures completely gone. So we did an exam, we looked at him, and we placed 8 implants on the top and 8 implants on the lower arch. And then he had fixed crown and bridge, just like you would have on regular teeth. These are fixed. These do not go in.
They don't come out.
They don't come out.
Okay.
And this was a way that he was able to gain back some of that youth that gave him the confidence to go out and begin meeting people again. And the last I heard of him, there was a lady in his life.
What does he say when it's all done? Because now he has a fixed set of teeth.
He said, why didn't I do this sooner? Why did I put up with something that, now I realize I didn't have to. But he didn't know his options. And that's the biggest.
Do you make cosmetic dentures in your practice? I mean, you do,
We do.
dentures.
Absolutely.
When they get converted or somehow they end up with dental implants, do they ever say, "Doctor, why didn't you tell me?"
Yeah, no, somehow it's my fault that they didn't know
Oh, do
this
they
ahead
do
of time.
that?
Sure, absolutely.
So,
That's what this is all about.
Doctor, you should have
getting the word
really,
out.
because I guess you don't want to sell them or pressure them, but they do. They say, "You should have told me how good this was."
Yeah.
Is that right?
Absolutely.
My father, by the way, got dental implants, and he thought it was going to hurt.
Yeah.
And he's a tough guy, and he says it didn't hurt at all.
No, everyone is surprised. We'll even tell people ahead of time, you should have very little discomfort after they're first placed, much less than, say, an extraction.
Okay.
But after a couple of days of healing, then they're going to be completely comfortable. And as long as you have those implants, you don't have to worry about discomfort from them. See, bone doesn't have nerves in it. So when you place something that is biocompatible, in other words, the body accepts it, then you never have to worry about discomfort again from that.
So, okay. So the bone doesn't have the feeling.
Right.
It's just the gums.
Correct.
And there's very little trauma to the gums.
Absolutely.
Very little cutting.
Yeah, the way we do implants now is that there's less surgery. I liken it to the way we used to do surgery anywhere in the body, but now we've got the ability to make small incisions and do the type of things we used to do with this great big incision very, very atraumatically. So that's the same thing we do with implants. We place just a very small hole, and the implant is placed, and patients have little discomfort afterwards.
Fixed set of teeth. I mean, there's a
Fixed
full
set of
arch
teeth.
upper, full arch lower, and they don't come in and out.
Right.
And they go in what? Who cleans them? I mean, they go in every 6 months,
Right.
once a year?
We designed them so that they are self-cleaning. All the patient has to do is what they would do with natural teeth. Brushing, flossing, they may use a water pick, but they'll come back and see us for professional maintenance,
Okay.
which is a cleaning, just like with natural teeth, and they'll do that every 3 to 6
It
months.
seems like everybody wants a fixed set of teeth.
Most people would rather
It's
have...
just a little bit more expensive?
Yeah.
Is that why they all don't do it?
Well, there's more expense, okay, but most patients are going to want to have fixed teeth
Okay.
if they have that option.
All right. Insurance does not cover this, I guess, in the U.S., the whole dental implant process, even in Canada. Medicare doesn't cover this?
It does not.
But you have financing available?
We do have financing available, and many patients use that. And they tell us, when I'm done, they say, whatever you charged, it wasn't enough.
Is that right?
Yeah.
They complain that it wasn't enough. You should have charged me more.
Yeah, and they don't say that going in.
Right,
But
right.
afterwards, when they've got their teeth and they realize the experience was good, and for the rest of their life now, they never have to wear dentures again, they say that was priceless.
What if, and this is a question that people that their mouths are falling apart, really bad teeth, and I had a discussion with somebody about this. They say their gums are too bad for dental implants.
Yeah.
What happens if you have bad gums?
Well, the gum...
They're going to lose all their teeth and they have bad gums.
Yeah, so if someone has hopeless teeth, in other words, they have to have them extracted, many times we can place implants at the time of the extraction, which saves the patient even more time and saves them additional procedures, saves them additional cost, and also conserves the bone. Another thing to keep in mind, Randy, is that when someone has bad gum disease, when the teeth are removed, the gum disease goes away.
Okay.
Because in order to have gum disease, you have to have a tooth. So many times these people who have extensive gum disease, the teeth are extracted, the gums heal, implants are placed, and no more gum problems.
So now as far as experience, and this seems like an obvious one, right? But how important is experience in this? Because it sounds like an easy procedure.
Now, experience is important like in anything else.
Like, how do you choose a doctor that's going to do this? I guess that's my question.
Yeah, I think you need to ask some questions. Ask them questions about their background. Ask them how long they've been placing implants. Ask them if they do all the procedures in their office.
Okay.
Because that's going to be important. If the person placing the implant is also the person who is restoring that implant, in other words, making the teeth that go on the implants, then that provider has some advantages over going to one person to get the implant, going to another person to get another procedure, and then a third person to have the teeth made.
Okay.
Because the person who's placing the implant places it in such a way that we get the best cosmetic result. And the implants are wonderful, but what really gives me a charge is when that patient comes back and says, look at these, these teeth are gorgeous. I get compliments all the time.
So they look like real teeth?
Yeah, they look like real. And if they don't look like real teeth, then you haven't succeeded with that patient.
So smile. You think the smile's pretty important?
The smile is everything. Okay, the smile tells...
Well, you're a dentist, of course you think that.
Yeah, but that's what people often notice first about a person is their smile. And if they smile, they're happy. And people want to be around happy people.
Okay, I'll buy that. Look, pleasure having you on the show. If somebody is watching this, the denture wear specifically, 2, 4, 6 implants you say for snap in, snap out or fixed, but they're still afraid. Maybe they're skeptical. They go, I was told I was too old. What do you say to them? And what's their next move?
Well, first of all, keep in mind what you're going to receive. So if we keep our mind on the end result, then whatever we go through to get to the end result, it's worth it. Second of all, is that whatever you have to go through to get that end result is that we've already come up with solutions to make you comfortable, to make it the experience as positive as possible. If you're anxious, we've got sedation. You won't feel anything and you'll have little or no memory afterwards.
Okay.
If you have issues with affordability, we've got ways to make it more affordable. Don't let fear, don't let money, don't let any obstacle keep you from having a better quality of life.
Can they see you?
Absolutely.
Consultations are free?
Consultations, no charge.
So there's no excuse, right?
There's no excuse not to have.
Pleasure having you on the show. Great information.
Thank you, Randy. Appreciate it.
Good stuff. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you go to our website at wellnesshour.com. If you just caught the last 10 minutes, put in Dr. Feck and you'll see the whole interview. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.